This is Scott Becker at McGuireWoods, also publisher of Becker's Healthcare. I'm going to spend a few minutes today talking about the impact on surgical practices and surgery centers and then what ramping back up starts to look like. So first, 8 to 10 points on the impact on practices. 1, devastating financial impact on surgical practices and surgery centers. Most practices essentially stopped entirely sometime in mid-March. When you're a surgery center or a surgical practice, your cash flow will continue for 4 to 6 weeks after stopping procedures, but then at some point, 4 to 8 weeks after, will plummet dramatically. So cash will keep coming in, and then at some point will dramatically slow down. Cash flow will take a while past ramp up to ramp back up. So even to talk about ramp up scenarios, we're looking at 3 to 4 months till some cash flow really starts to come in, and probably much longer than that until there's significant cash flow in practices again. Telehealth, critical for practices in maintaining relationships and doing consulting with their patients, but even with reimbursement for telehealth visits, surgeons, proceduralists, gastroenterologists, orthopedic surgeons, ophthalmologists, pain management physicians really make their cash flow and pay their bills from doing procedures. So the movement of telehealth, while a great thing, doesn't replace the cash flow and the need for revenue that procedures generate. And certainly for surgery centers, doesn't do any good at all. A couple quotes from practitioners. 1, the naked fact is we are in deep economic trouble. 2, to continue for 60 days more would end my practice as it now stands. And a lot of this is true for surgery centers and surgical practices. In terms of ramping back up and what that looks like, just a few points. Many states are about to start allowing elective and non-essential procedures. It will take a while for practices to ramp back up and to generate cash flow. As we mentioned before, a few months, at least, till cash flow really starts to return. And we assume that practices, even though there will be pent-up demand, there will be some slowness as there's new procedures and protocols put in place and to keep people safe, patients, staff, physicians, and also due to recessionary situation that we have in our country. So it'll take a little bit. There will be lots of prophylactic steps, things like masks for everybody, probably no family or friends in the waiting rooms, bigger space in the waiting rooms, possibly, as soon as possible, rapid testing of COVID, but this will take a little bit to get up to scale, that kind of testing that's needed. More caution all the way around. Probably better off in surgery centers and ASCs for a while, in practices for a while, just because there'll be less people, less critical mass of people, less chance of getting infected. We will see more and more prophylactic steps come from the associations, the CDC, and we also expect that practices will continue to suffer for a while some horrendous cash flow months. It will take a while for this to ramp back up. The last thing I will say is practices should itself form their own governing rules as to what ramp up is going to look like. I've heard many places talk about we're going to have a couple phase ramp up where we reevaluate in a couple weeks what this looks like to plan for the next phase. Again, thank you very much. Just a quick talk today on the impact on practices and what ramp up looks like. We appreciate you greatly joining us today. Thank you.